Early signs of stroke. One of the major problems in treating stroke is that most people do not know what the symptoms are. If you or a loved one has even one of the following symptoms, call an ambulance right away. Tell the correspondent that you think a stroke has occurred. Weakness or paralysis, loss of strength of one arm or leg or one side of the body. Numbness, loss of feeling or pins and needles on one side of the body. Lack of intellectual capacity, trouble understanding what someone is saying. Vision problems, sudden loss of vision in one or both eyes or sudden double vision. Problems with balance and coordination, sudden change in balance and difficulty with coordination. Headache, sudden, explosive, severe headache. Notable facts: every 45 seconds, someone in the United States has a stroke. Getting more fiber is associated to less rigorous strokes, according to the findings of a Boston study of 50 men and women. Consumptions of both entirety fiber and insoluble fiber were reciprocally linked to stroke severity. The average fiber intake in the study wasn't even high, only 10 grams a day, which is less than half the daily value of 25 grams a day. A stroke can take place when a blood vessel carrying blood to the brain is blocked by a blood clot. This is called an ischemic stroke. A blood vessel breaks open, causing blood to leak into the brain. This is a hemorrhagic stroke. If blood flow is stopped for longer than a few seconds, the brain cannot get blood and oxygen. Brain cells can die, causing permanent damage. Stroke dangers. High blood pressure is the number one reason that you might have a stroke. The risk of stroke is also increased by age, family history of stroke, smoking, diabetes, high cholesterol, and heart disease. Certain medications increase the chances of clot formation, and therefore your chances for a stroke. Birth control pills can cause blood clots, especially in women who smoke and who are older than 35. Men have more strokes than women. But women have a risk of stroke during pregnancy and the weeks immediately after pregnancy. Cocaine use, alcohol abuse, head injury, and bleeding disorders increase the risk of bleeding into the brain.